5 common injuries in American football. Concussions. Concussions are a type of traumatic brain injury that can occur as a result of a blow to the head or body. In football, concussions can be caused by tackles, collisions with other players, or falls to the ground. Symptoms of a concussion may include headache, dizziness, confusion, memory loss, and nausea. While most concussions are mild and resolve on their own within a few days to a couple of weeks, they can have serious long-term consequences if not properly treated. It is important for players who have sustained a concussion to rest and avoid physical activity until they have fully recovered. Sprained ankles. Ankle sprains are common injuries in football, often occurring when a player's foot is planted awkwardly and the ankle rolls outward. This can stretch or tear the ligaments, causing pain, swelling, and difficulty walking. Treatment for a sprained ankle typically involves rest, ice, compression, and elevation, RICE, to reduce swelling and inflammation. In severe cases, physical therapy or surgery may be necessary. Knee injuries. Knee injuries, such as tears of the anterior cruciate ligament, ACL, or medial collateral ligament, MCL, are common in football. These injuries can occur as a result of a sudden change in direction, a tackle, or a collision with another player. Treatment for a knee injury may include rest, ice, physical therapy, and, in some cases, surgery. Fractures. Football players are at risk for fractures, or broken bones, due to the physical nature of the sport. Fractures can occur in any part of the body, but are most common in the ribs, fingers, and collarbone. Treatment for a fracture typically involves immobilization of the affected limb or joint with a cast or splint, followed by physical therapy to restore strength and mobility.